First, I will be describing the extent of the problem. Chlamydia is a sexually transmitted disease and is the most commonly reported STD in the United States. Nearly 3 million Americans contract this STD every year, and it is the most prevalent among 14 to 24-year-olds. In the year 2016, there was a reported 1,598,354 cases of chlamydia in the United States, according to the CDC. 1,072,719 of the total reported cases were women, and only 522,870 of those cases were reported men. The cases of this STD were reported highest in the South. According to the CDC, there are an estimated 20 million new STD cases every year, which is costing nearly $16 billion in healthcare costs annually. Here is a chart from the Center for Disease Control and Prevention's website. It's a report of the reported cases of chlamydia by age group and sex in the United States in the year 2016. As you can see, the highest reported cases were among 14 to 24-year-olds, specifically women. Next, I will be describing the environmental factors that affect the contraction of chlamydia. There are definitely certain environmental factors that have an effect and make people vulnerable to contracting STDs, in this case, chlamydia. Specifically, there are social and economic factors that have a major impact. Certain racial and ethnic groups also have high rates of STDs, specifically African Americans, Hispanics, American Indians, and Alaskan Natives. A very high rate of chlamydia occurs with young people 14 to 24 years of age. An environmental factor that affects the rate of chlamydia is a high poverty rate and also disadvantaged neighborhoods. This is because in these disadvantaged neighborhoods, more high-risk sexual behaviors are common and access to healthcare is limited. Another factor that has a big impact on the rate of chlamydia is a lack of education. People who are uneducated on safe sex and the dangers that accompany it are much more likely to engage in high-risk sexual behaviors.